In this video, we're going to talk about what is going on with Justin Bieber's eye and the side of his face. Let's get into it. Welcome back. I'm Zach with Dr. Eyeball MD. I'm an oculoplastic surgery fellow. Today we're talking about what is going on with Justin Bieber's face. He recently posted a video on TikTok talking about how half of his face was paralyzed and he was diagnosed with something called Ramsay-Hunt syndrome. What is Ramsay-Hunt syndrome though, and what does it mean for him as a singer, for his health and for his face, the recovery of the paralysis, and ultimately for his eye, because that's what I do. I do surgery on people that have these type of facial paralyses, and the sequela that it can cause in the eye can be pretty dangerous. So we'll talk about that in a second. But let's watch the video. Let's respond to the video.
Hey everyone, Justin here. I wanted to update.
So right away you can notice the right eye is not blinking, and when he raises his brows, the right side of his brow is not moving. So that facial nerve is paralyzed completely. It controls the entire movement of the whole side of the face. This is different than someone who's had a stroke. If someone has a stroke and they have facial droop, a lot of times it spares the upper part of their head. So they're still able to move their brow with a stroke, but from here down will be paralyzed. So this is more consistent with a lower motor neuron paralysis, which you would expect with something like Ramsay-Hunt syndrome.
You guys on what's been going on. Obviously, as you can probably see from my face, I have this syndrome called Ramsay-Hunt syndrome, and it is from this virus that attacks the nerve in my ear.
So the virus that he's talking about is the chickenpox virus. It's the varicella zoster virus. This is the virus that causes chickenpox in kids, and it can reactivate later in life to cause shingles. So when we were little, people our age, I'm 31, we didn't have a vaccine for chickenpox. So we all got chickenpox as kids, and we built up a natural immunity that way. But the problem is that the virus can lay dormant in the cells, in the ganglion of the cells. So if you think of a nerve like a long little noodle, it can activate at the end out on the skin and the dermatomes, cause the rash that's associated with chickenpox or shingles, and then it travels back through the nerve, and it lays dormant in kind of the cell body, the ganglion cell body, and it can hide there for years and years, and then things like stress or disease can cause it to reactivate, and then it can kind of come back later. So people who had chickenpox as kids can get this reactivation as shingles as an adult. So that's the virus that he's talking about. So this virus lays dormant in the geniculate ganglion, and that's why it affects the facial nerve. That's pretty close to the 8th cranial nerve as well. That's why you get the hearing issues with Ramsay-Hunt syndrome right at the cerebellopontine angle. Those nerves are pretty close, and that's one of the theories, at least, as to why it affects multiple of these cranial nerves. Let's keep watching.
My facial nerves, and has caused my face to have paralysis. As you can see, this eye is not blinking. I can't smile on this side of my face.
So this is a huge problem with facial nerve paralysis. So the facial nerve innervates the muscles that close the eye, the orbicularis oculi muscles. Those close the eye, and you have to have that to blink and to close your eye. And if you don't have that, the eye can dry out. When the eye dries out, the surface becomes very susceptible to something called an epithelial defect, where you lose the front surface of the cornea of the eye. And when that happens, it becomes very susceptible to infection. So a lot of times these patients who have facial paralysis, if they don't have good closure, they'll be sleeping at night, the eye is open, it dries out, it gets an ulceration, and that ulceration gets infected. You get a corneal ulcer, and these are major problems. You can lose your vision, and we not infrequently remove people's eyes that get bad infections from this. So that's where the danger for the eye comes with these facial paralyses.
This nostril will not move. So there's full paralysis in this side of my face. So for those who are frustrated by my cancellations of the next...
So resting will definitely help your body recover. So when it comes to the treatment of Ramsay-Hunt syndrome, there's really two medications that are going to help. And that's one to treat the virus, to treat the varicella zoster virus that's reactivated. And that's things like acyclovir. These are antiviral medications. And the other one is prednisone. It's a steroid, and that can help with the inflammation of the nerve that's causing the facial paralysis. So these things have to be started pretty quickly. So it really depends on the onset of symptoms to the time of starting these treatments as to how fast and how well, if at all, the facial paralysis does recover. And so if his doctors are able to start the treatment within the first few days, like 3 days, the chances of recovery are pretty good. About 70% of recovering full animation of the face and the paralysis resolving. If they wait a full week, that drops to about 30%, which is not great. So I don't know how quickly they jumped on it. Hopefully they jumped on it quickly, and hopefully he's able to regain all the function of the facial nerve, but it's not a guaranteed thing. So some of the problems that can come from this, like I said, in particular the eye, because that's what I do, is oculoplastic surgery. So oftentimes when patients have these long-standing facial paralyses that don't resolve, and keep in mind, we give these months to resolve, like 6 months at least, before we go in and do anything surgical, unless there's real danger to the eye becoming overexposed and developing an exposure keratopathy. We'll typically try to give time for the nerve function to recover. But if they don't, what are the options, at least surgically, that we can fix this problem with the eye not closing? One is a gold weight. We'll actually implant a gold weight in the upper eyelid. It gives extra weight to help it close so that it's not open and getting exposed. Another one is called a lateral tarsal strip procedure, where we'll tighten the lower eyelid if the lower eyelid is falling away from the eye, not hugging the eye. Obviously, that's not the case in Justin's age. Someone younger like this, that tends to be less of a problem. But because that orbicularis oculi muscle loses its innervation, it becomes paralyzed and weak. The lower eyelid can start to fall away from the eye, which is a problem. So sometimes we have to tighten that with the lateral tarsal strip procedure. The other things that we'll sometimes do is something like a tarsorrhaphy, which can be temporary, or it can last as long as we need it to, where the eyelids are actually stitched together. If you go check out my Instagram, I have some videos where I actually do this. But those are some of the things that can be done if it doesn't resolve down the line and the eye starts to become exposed and develop exposure keratopathy, which can be very dangerous, as I said. Hopefully, though, he will regain function. I'm sure they put him on the medications to treat it, acyclovir and prednisone, to try to help speed the recovery, and hopefully he can get full recovery. But that's kind of what's going on here with Ramsay-Hunt syndrome, and that's kind of the treatment modalities and the prognosis and how it kind of plays in to affecting the eye. Like I said, can be pretty dangerous, but I'm sure that he's following an ophthalmologist and they're treating that. The other kind of more conservative things that he should be doing at this point are lubricating eye drops, so artificial tears around the clock, doing those throughout the day to keep the eye from drying out, because without blinking, the eye is going to dry out. And when he goes to bed, he can either patch the eye closed, use something called a moisture chamber, or put a lot of ointment or lubricating gel or ointment in the eye before bedtime to keep it from drying out at bedtime. So anyways, I hope that kind of clears up some of the things that's going on with Justin Bieber's Ramsay-Hunt syndrome, facial paralysis, how it relates to his eye. Hopefully he gets full recovery, and we wish him all the best. Anyways, if you guys enjoyed this video, leave a like, subscribe to the channel. I'm Zach with Dr. Eyeball MD. I'll see you guys in the next one.